Hi, I'm Dr. Mel. In this video, I want to share some of my knowledge and experience about the latest medical diagnosis of world-renowned singer Justin Bieber.
Hey everyone, Justin here. I wanted to update you guys on what's been going on. Obviously, as you can probably see from my face, I have this syndrome called Ramsay Hunt Syndrome.
Popular Canadian singer Justin Bieber has announced yesterday that he is suffering from a facial paralysis due to Ramsay Hunt Syndrome.
What do we need to know about this syndrome? Ramsay Hunt Syndrome, or herpes zoster oticose, is caused by same virus that causes varicella or chicken pox. We can only have one episode of varicella in a lifetime, but after you have improved from chicken pox, the virus will try to live in the nerves and can reactivate years later. This is what happened to Justin Bieber. Herpes zoster or shingles is more common than Ramsay Hunt syndrome or herpes zoster oticose. I see a lot of patients with herpes zoster, but in my 30 years of medical practice, I think I only saw one patient with Ramsay Hunt syndrome. In herpes zoster or shingles, there is severe pain in the area where the vesicular lesions appear with an erythematous base. It is extremely painful because it follows the course of a nerve or dermatome, and sometimes it can lead to more prolonged cases that can lead to postherpetic neuralgia, which can be responsible for significant financial burden due to cost and prolonged intake of medicine. The other form of herpes zoster is herpes zoster oticose or Ramsay Hunt syndrome, which is the current diagnosis of Justin Bieber. What do you need to know about this syndrome? Or RHS is a rare neurological disorder where the previously inactive or dormant or sleeping varicella zoster virus gets reactivated and spreads to affect facial nerve. This leads to irritation and swelling of the nerve. This condition mainly affects adult and in rare cases can also be seen in children. Ramsay Hunt syndrome or RHS is characterized by 1. Severe ear pain. 2. Vesicular-filled lesions affecting ear or mouth. 3. Ear abnormalities such as ringing in the ears or tinnitus and hearing loss on one side. 4. Sensation of things spinning or vertigo. 5. Weakness on one side of the face that causes difficulty closing one eye. Difficulty in eating as food falls out on the weak corner of mouth. There is also difficulty making facial expressions and fine movements of the face, as well as facial drooping and paralysis on one side. Are there diagnostic tests that need to be performed? For me, clinical symptoms will be enough for a healthcare provider to diagnose this syndrome, but these tests can be done like 1. Blood tests for varicella zoster virus. 2. Electromyography. 3. Lumbar puncture in rare cases. 4. MRI of head. 5. Nerve conduction test to determine the amount of damage to facial nerve. How about the treatment of RHS? Strong anti-inflammatory drugs called steroids, such as prednisone, are usually given. Antivirals such as acyclovir or valacyclovir is also given. Painkillers are also added to treatment regimen. Wear eye patch on the affected eye to prevent damage as the eye does not close completely. Artificial tears can be used during the day to prevent drying out of the affected eye. And if with dizziness, your healthcare provider can prescribe anti-vertigo. And how avoid prevention? Can we do something to prevent varicella zoster virus infection? Absolutely yes. Just as I have always been an advocate, please watch my previous We Have Available Vaccine videos for varicella to prevent chicken pox for children 1 year old and above, and also vaccine for shingles is available. I hope you learned something in this video. If you haven't subscribed, please do so. Share and comment down below about topics you want me to discuss. Thank you for watching.